Let's look at one of the cancers that is affecting more young people than it has been happening before. Colorectal cancer. This is the second commonest cancer diagnosed. It affects the digestive system and affects more than 2 million people worldwide. And it has been estimated to cause over 800,000 deaths annually. Usually, the colon has several parts. We have the first part of the colon, which we call the ascending colon, which is found on the right side. We have the transverse colon, which is the middle part of the colon. We have the descending part of the colon. Then we have the rectum and the sigmoid colon. And then we have the anal opening. Most of the colorectal cancer develops from precancerous polyps, which when detected early can be removed. So this can also be cured if diagnosed early. Colorectal cancer is increasing more and more among younger people less than 45 years, and this seems to be affecting the colon and the rectum. So let's look at some of the risk factors that lead to colorectal cancers. We have the modifiable risk factors. These are things that you can be able to change in your life to prevent yourself from getting colon cancer. And one of the commonest known cause is high intake of lead and processed meats. This puts you at a higher risk of getting colorectal cancer. People who have physical inactivity and who are obese are also at a higher risk of getting colon cancer. Low fluid and vegetable intake, high intake of alcohol, history of smoking. Then we have the non-modifiable risk factors. These are things that are innate in you which you can do nothing about. The first one being age. As you age above 45 years, you have more chances of getting colorectal cancer. People who have some common inflammatory bowel diseases. These are diseases that affect the colon, including diseases like Crohn's disease and also ulcerative colitis. People who have a history of polyps in the family. If you have a family history of colon cancer, especially those who have familial inheritable polyposis, which is a disease that is characterized by the presence of polyps in the colon, and also those who have a syndrome which is called Lynch syndrome. They have higher chances of getting colon cancer. So which are some of the commonest symptoms that indicate you could be having colon cancer? Initially, in its early stages, the colon cancer has no symptoms, especially if it is affecting the ascending part of the colon, which is on the right side. You may not have any symptoms, and if the symptoms are present, they might present late. So one of the symptoms could be palpable masses on abdominal examination. We have dark red stools because of staining with blood. We have change in bowel movements, which you could be having constipation, which is hardening of the stools. You may have episodes of diarrhea. You may also increase frequency of the bowel movements. You may have mucus per rectum. You may have tenesmus, which is a feeling like you want to empty your bowels, but when you go to empty your bowels, you are unable to. Then you may have a feeling like you have incompletely emptied your bowel, especially if the rectum is affected. You have persistent abdominal discomfort. You may have weakness and fatigue. You have unexplained weight loss, which is not intentional. Some people will present late with the iron deficiency anemia. This is anemia that is characterized with the loss of iron from the persistent loss of blood from the rectum. And of course, in the later stages of the disease, you may have intestinal obstruction presenting with vomiting, inability to pass flatus, and also abdominal distension. So colon cancer can present in various forms. You may have polyps which grow inside the lumen of the colon. You may have ulcerations. and you may also have stenosis, which is narrowing of the colon lumen. So what are some of the investigations that you can do to make a diagnosis of colon cancer? Of course, the first one is the patient present to the health provider. You do the history of what are the complaints of the patient. Then after that, you do an abdominal examination. You are looking for masses. You are looking for any distension. And then there is also a rectal exam through the anal orifice. And there you will be looking for the presence of blood, either in the examining finger, or also the presence of blood in the feces. There is a test that is also getting out of use, which is called barium enema, where there is contrast put through the anal orifice. The gold standard for diagnosing colon cancer is colonoscopy, where a flexible tube is put through the rectum, and if any area of ulceration or ulceration can be seen visually, and then a biopsy is taken. You can also do what we call tumor markers to try to diagnose colon cancer. The gold standard for screening for colon cancer is fecal occult blood, or we have fecal immunohistochemical test, which test for the presence of blood in the feces. When you are doing fecal occult blood, then you need to have fasted from meat for at least 3 days, so that because the test can also pick any blood from ingested meat. Then for staging, then you can have an abdominal CT scan, which helps in the staging of the cancer. The metastasis of the colon cancer happens in various stages. You can have disease that is localized in the colon, which is stage 1. You can have local extension from the colon. It goes to the surrounding lymph nodes. Then from the surrounding lymph nodes, it can go to the blood vessels and the lymphatic system. If it goes to the lymphatic system, then it will go to the vertebral column. And then it can also spread through the bloodstream to the liver, to the lungs, and also to the brain. So screening for colon cancer provides an opportunity for detection and removal of the precancerous lesions, which can prevent or delay the occurrence of colon cancer. Detection of early stage disease always allows early treatment and also helps early intervention, so that you have good clinical outcome. Colonoscopy and the fecal occult blood, or the fecal immunohistochemical test, are the recommended tests for screening for colon cancer. So as you can see, is that colorectal cancer is highly preventable if you go for the screening test, which we have already indicated the screening test that you can do. If you are found with the cancer which is already advanced, then the treatment procedures include surgery, where in surgery you can have partial removal of part of the colon. Depending on the colon part that is affected, you can have partial removal of the colon. Then you have adjuvant chemotherapy. This is chemotherapy using drugs to try to remove any cells that could be remaining after surgery. And then you have palliative care. Palliative care is end-of-life care to those who have advanced disease, which has metastasized to the liver, to the brain, and the other parts of the body. So thank you very much. Please, let's all take the necessary steps to prevent ourselves from getting colon cancer. Let's go for the screening. Let's improve our lifestyle by working on our exercise program, looking at our diet, ensuring that we have high intake of fruits and vegetables, and remaining active. If you are a smoker, stopping smoking, and also reducing your alcohol intake for better lifestyle. Thank you for watching.